Do you long for the perfect smile every time you look in the mirror? If so, there's a minimally invasive procedure to restore your teeth with immediate results for most patients. Here to tell us more is Dr. Cindy Brayer. She is with Creating Smiles Dental. Welcome back, Dr. Brayer.
It's great to be here.
So many people are looking to do this. What cosmetic procedure are you finding is most effective?
So one of our newest, most popular procedures is called Componeers, and we love this for a variety of reasons. First, it's very conservative, which means we just place it, directly on top of your tooth structure without grinding any tooth structure. Second, it's very convenient since we place it all in one visit. Third, it's easy to repair, and since we can just repair it all in one visit when you come in. And the last thing is that it's very affordable since it's less costly than traditional porcelain veneers.
So yeah, what exactly are Componeers and how do you put them on the teeth?
So their Componeers are a prefabricated composite shell that's manufactured through a machine, and so there's no air bubbles, which is really important because then it's more resistant to staining, discolorations, and abrasions.
And how do they go on the teeth?
It's actually very simple. We literally just bond it directly onto your tooth with a composite material, and then we smooth it and we polish it and we make sure that your bite is fitting, and that's it.
That sounds simple. When do you recommend Componeers for patients?
We recommend it for certain cases of like tooth decay, fixing many old front fillings, attrition, abrasion and erosion, and tooth fractures. And additionally, Componeers help to cosmetically extend incisors longer, correct teeth that are malaligned or crooked, and fix discolorations. And they also correct anatomical malformations of teeth. So basically, teeth are not ideally aligned. Generally, we recommend Componeers for any patients who are looking to change the look of their smile.
In so many different ways, as you described.
Mm-hmm.
So let's take a look at a couple of cases, and as we show them, will you tell us a little bit about each one?
Absolutely, yes. So in this first case, this patient has thinner, narrower teeth that were not straight, so we did Invisalign to straighten his teeth, and then we placed Componeers on as the last finishing touch to give that ideal whiter smile with larger teeth that the patient has always wanted. In this second photo, this patient was getting married soon and had some spacing in his front teeth, and he wanted to have a more ideal smile for his wedding, and so we did Invisalign to close his gaps, and then we placed Componeers to give him his beautiful smile, and he was so happy with the results for his wedding. And in this last photo, the patient came in complaining that her teeth were darker and discolored, and she wanted veneers, and she really liked the idea of Componeers because we didn't touch her enamel and only placed the Componeers over her tooth structure, and now she loves her new smile. So in all of these cases, I really want to emphasize the fact that I did not touch their tooth structure, and that was being very conservative. And this is so important because let's say one day the patient decides that they don't want the veneers on and they want their natural tooth structure back. And so all we do is we go in and we just smooth off the Componeers and you're back to your natural tooth structure. And additionally, we do it all in one visit, so there's no impressions, there's no sending it to the lab, there's no temporaries, and patients really love that convenience.
How long do they usually stay on?
For years, actually. We haven't had a case yet where they've come off, unless if someone chipped it and broke it, and then we just fix it really quick.
Sounds good. Dr. Brayer, thank you very much.
Thank you.
If you would like to hear more about Dr. Brayer's procedure, just visit creating-smiles.com or call one of their 2 locations in St. Petersburg and Clearwater.